Hi dear colleagues, I'm Dr. Kızıltunç from Turkey. In this issue of ABC Cardiology, our manuscript entitled Serum Sirtuína 1, 3 and 6 levels in acute myocardial infarction patients will be published. Sirtuins are NAD-dependent enzymes, and it's suggested that some types of sirtuins may have beneficial effect against endothelial dysfunction, against left ventricular hypertrophy, and against reperfusion injury during acute myocardial infarction. So we wondered what happens in serum sirtuin levels during myocardial infarction course, and therefore we designed this study and firstly compared serum sirtuin levels in acute myocardial infarction patients and in control subjects, and we investigated if there was any temporal change in serum sirtuin levels during acute myocardial infarction course, and finally we investigated if there was any association between serum sirtuin levels and prognostic markers that can be used in acute myocardial infarction patients. These prognostic markers are peak troponin levels, pro-BNP levels, Grace score, left ventricular ejection fraction detected by echocardiography, and serum CRP levels. When we collected our data and analyzed our results, we saw that serum sirtuin levels were similar between acute myocardial infarction patients and control group with patients' normal coronary arteries, and we saw that again saw that serum sirtuin levels were similar at admittance at the first day of the ischemic insult and at the second day of the ischemic insult, and there was no temporal change in serum sirtuin levels during the myocardial infarction course. And finally, we cannot detect any association, any correlation between serum sirtuin levels and prognostic markers of acute myocardial infarction. In conclusion, our study is showing that serum sirtuin 1, 3 and 6 levels are not useful and reliable markers in acute myocardial infarction patients for any diagnostic or prognostic purposes. Thank you very much.